And we're wrapping up this tour and we're bringing it back to Vancouver with Simon. Simon Rayek is the manager of health promotion at Health Initiative for Men, HIM. He brings years worth of experience in LGBTQ health prevention, promotion, and community advocacy. His work includes disseminating research data to his communities and as well as contributing to research projects as a representative of HIM and the communities that HIM serves. Welcome, Simon.
Excellent. So being last offers me a unique opportunity in that though the effects of the morning coffee have worn off, I've had 9 individuals warm you up, and now I get to finish you off. Oh, come on, that was a great joke. You're all too tired. I don't know, man. All right, so thanks for having me. I'm excited to share how we at Health Initiative for Men plan on implementing the Advanced project here in Vancouver and the BC and the Lower Mainland. I see a lot of local faces. I see a lot of visitors. So when we say Lower Mainland, we do refer to the Metro Vancouver area and its surrounding suburbs. And of course, I cannot start without recognizing that HIM operates within the ancestral, traditional, and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. This is not an idle token of recognition. Rather, it is a reminder of our obligation to be cognizant of the relationship we hold with the historical and ongoing societal and territorial displacement of Indigenous peoples here and throughout Turtle Island. I'm going to do a little bit of signposting. First, I'm going to set the scene, tell you a little bit about HIM, the populations we serve, HIV combination prevention, and then we're going to get into the meat of the presentation, which is the work we're doing as part of Advance. So who is HIM? HIM was founded 10 years ago with the purpose of serving the holistic well-being of queer men. Since then, HIM has become a pillar of the queer community, serving the unique well-being needs of our communities. And just for reference, that includes gay, bi, and other men who have sex with men, cis and trans, as well as two-spirit and non-binary people. HIM operates 5 health centers where we offer the full spectrum of sexual health testing as well as counseling. We're also known for our health promotion work, which you can see a little bit up on the screen, as well as collaborations on cutting-edge research projects, including with some of you here in this room. So, giving you a rough number of the populations we serve, in British Columbia, of the 4.8 million people that live here, it is estimated that about 51,000 of them are GBT2Q. Most of those, of course, are in the Vancouver coastal health region, with 26,000 and nearly 12,000 in the Fraser health region. And though there are 5 health regions in BC, these are the 2 where we mostly operate, and those are the 2 that most of our work will be focusing on, though we do have funds to hire support coordinators across BC, so we will be able to scale some of our interventions to other places, which is very exciting. HIV in BC and the Lower Mainland. It is estimated by PHAC, the Public Health Agency of Canada, that about 12,000 people live with HIV in BC. 49% of them are GBT2Q. And HIV prevalence in the Lower Mainland is estimated to be 19%. Approximately 300 people contract HIV annually in BC. GBT2Q populations constitute about upward of 60% of all new diagnoses, and that's according to the BC Centre for Disease Control. HIV incidence rate in BC GBT2Q stands at 1 per 100 persons, and that's in BC. That number goes up slightly if you're focusing on the Lower Mainland with 1.1, and that's according to data from the Momentum study. Combination prevention in BC. We're very fortunate to be working within a province and with the health authorities that recognize the importance of serving these high-risk populations. So compared to some of my colleagues, in some ways, we're quite lucky. So what we have right now is NAT and 4th generation testing. NAT testing is available to clinics throughout BC serving high-risk populations, including GBT2Q, and 4th generation tests are available throughout the province. Point-of-care testing has been available since 2012 through the BC CDC point-of-care HIV testing program. And again, that's specifically meant for clinics that serve high-risk populations. We also have a number of innovative testing methods, including anonymous testing, which is offered at the 5 HIM health centers, as well as 10 other testing sites throughout BC. And a favorite of mine, the Get Checked Online program run out of the BC Centre for Disease Control, wherein users can requisition blood work for HIV STBBI testing online. And after depositing their samples at one of the many LifeLab clinics in BC, they receive their results online or over the phone, depending on the results. And it is, I talked to someone who works on GCO yesterday, and he approximates that there are about 4,000 people in BC enrolled in Get Checked Online currently. Effective January 1st, 2018, access to PrEP in BC was made available through the BC Centre for Excellence in HIV/AIDS at no cost to qualifying individuals deemed clinically at risk for HIV infection. So as of October, just last month, there are 2,700 GBT2Q people throughout the province accessing PrEP for free through this program. 1,700 of those are in the Vancouver coastal region, 480 in the Fraser Health region, and we estimate that there are about 500 prescribers of PrEP throughout BC. We at HIM are very proud that upwards of 50% of all new prescriptions are done through the HIM health centers. HIV treatment, I was shocked to learn that for people living in HIV in some of these other places, treatment is not covered for them. Thankfully, here it is. And if you look at the cascade of care for GBT2Q, you see that 98% of GBT2Q living with HIV are linked to care, 83.7% are on treatment, and 70.5% have suppressed viral loads. And that puts BC, along with the numbers of the general population, put BC on track to meet the UN 90-90-90 target by 2020. For those of you who don't know, that would mean 90% diagnosed, people living with HIV, 90% of those on treatment, and 90% of those with suppressed viral loads. Excellent. Now we can move on to the work being done on the ground. So though we are fortunate to be working here, of course there is still work to be done. Our mission is to improve access and uptake of combination prevention health tools and services for GBT2Q, as it is for everyone else on this stage, I think. Matt Harding might not agree. Our priority is to ensure the equitable distribution of existing and future combination prevention services through intersectional and syndemic lenses. In this brief presentation, I've been talking about GBT2Q populations as if we were a monolith. This is far from the truth. There are gaps in who is being served and who isn't, and that has a lot to do with who has power and who doesn't. Our focus then will be not to exacerbate existing health disparities in GBT2Q populations as new combination prevention methods become more accessible. And our approach to that is to empower and support marginalized communities in creating tailored programming that works for them, instead of the traditional method of sort of making programs from a powerful center and trying to funnel marginalized and forgotten populations into it. Now, the actual work that we have been doing so far, like with everyone else, our focus this first year has been on formative research, identifying service gaps in marginalized communities, and this has been done through analysis of surveillance data, including SexNow 2014-15, the clinic intake forms that everyone who goes to a HIM health center fills in, Mobilee's data, which we were able to get access to. Very grateful for that. And of course, we're excited to see the results out of SexNow 2018, which we were a partner site for, and we spearheaded the effort here in Vancouver with 4 collection sites at 4 different prides. I should say we've had numerous community consultations, though those will really be ramping up in the new year with help of our new Advanced at HIM coordinator, Carmen, who's in the audience. We're building partnerships and trust. That would be both with community members and expert stakeholders. Those would be individual relationships and creation of community engagement committees and expert engagement committees. Almost done. And in keeping with our commitment to equity, we are prioritizing diversity of experience. Peer-based education. I'm really excited to tell you about the BC Community Advocates Program happening right now in this room. In partnership with the Community-Based Research Center for Gay Men's Health and the Men's Health Initiative out of Kelowna, we brought down 15 community members from rural and small urban communities across BC to the summit, with the intention that these community members go back to their communities and educate their peers on what they've learned here. This is a pilot, and we expect will happen throughout the next 5 years here at the summit. And finally, oh, thank you. Yes. Finally, our Capstone pilot intervention for at least the first part of this project, which we hope to roll out 2019-20, will sort of focus on GBT2Q who don't disclose. That would be to their family members, to their friends, to their communities. You might think of these people as maybe closeted, though we know that to be an ineffective and oftentimes a culturally insensitive term. And this is a strong intervention in that it crosses lines of geography, age, race, socioeconomic, sexuality, gender. So while we get our formative research really in line and we're able to identify gaps in specific communities, we can do a broader intervention that sort of crosses along these lines. That's it for me. I'm always eager to meet with community members and others working in health promotion to help enrich the work I do. Please feel free to reach out if you'd like to. Yeah.
Thank you, Simon, and thank you so much again to the Advanced Avance team.